All right, welcome back to ABA exam review and the continuation of our BCBA practice questions series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. The hotel lobby serves coffee in the morning, but in order to get coffee, I must first walk down 3 flights of stairs and then take a 7-minute walk through the halls. If coffee is my reinforcement, what type of schedule does this resemble? So we're starting here with a reinforcement schedule question, and it is a compound schedule question. How do we know it's a compound schedule? Well, we have more than one schedule going on at a time. What are our two schedules? So when you're dealing with reinforcement schedules, especially compound, we always want to first identify what is the schedule, because that's going to help you get to the answer choice. So the first schedule, because our reinforcement is coffee, is walking down 3 flights of stairs. Now, this might be a ratio schedule. It looks like a ratio schedule because we have to go through all these stairs. It could be an interval schedule if it's timed. It doesn't really make a difference. We just know this is the first schedule we have to complete. After we complete the flights of stairs, we have to take a 7-minute walk through the halls, which is going to be an FI7, a fixed interval 7. So we know we have two schedules back to back. And in order to earn reinforcement, we have to complete those schedules in that order. We can't take the 7-minute walk before we go down the flight of stairs, but we can't get the coffee unless we go down the flight of stairs and then take the walk. So what type of schedule does that resemble? A, chained. Yes, right? A chained schedule says you must complete 2 or more basic reinforcement schedules in a row to earn reinforcement, and SDs are present. Well, the SD is going to be present for the stairs, and the SD is going to be present for the halls. You know the order, you know what order you must complete the schedules in, and that's a very specific order in order to get reinforcement. What about concurrent? Well, concurrent is associated with choice because we have 2 or more schedules for 2 or more behaviors operating simultaneously. It's not the case here. We've got to engage in a specific sequence to get the coffee. What about alternative? An alternative schedule says we have an interval and a ratio schedule, and we've got to complete one or the other, either or. Again, not relevant here. We've got to complete both in a certain order. And then mixed says we have 2 or more schedules that are operating alternatively. And alternatively is not a good word to use here. I should say they're one comes first and then the next comes, and usually in a random order, right? So they're not operating at the same time, okay? And they're 2 different schedules entirely. They're not linked through a chain. That's what makes mixed a little challenging, the mixed and multiple schedule, because you can't really use alternatively even though you want to, because we have another schedule called alternative. That's kind of some of the issues we get into with compound schedules. Not that they're so difficult, they just get a little confusing. So take your time with compound schedules and don't confuse yourself with the wordage. Back to the question. If coffee is my reinforcement, what type of schedule does this resemble? It's going to be A, chained. A teacher tells the class that she is going to go around the room and call on different students. Students must provide a different answer than the previous 2 students in order for the class to earn their reinforcement. What type of schedule does this resemble? All right, back-to-back schedule questions. If you get into the exam and you get 2 consequence questions in a row or 2 verbal operant questions in a row, whatever it might be, you can't read into how the test is organized or the answer choices, anything like that. Answer the question in front of you. So what type of schedule are we looking at here? We know the teacher tells the class she's going to go around the room and call on different students. Students must provide a different answer than the previous 2 students to earn reinforcement. So this is what's called a lag schedule. And with a lag schedule, we're looking for students or learners to provide answers that are different than previous answers. And how are we going to know what type of schedule the lag is? Well, in this case, the answer must be different than the previous 2 students. So it's not going to be a lag 1. Lag 1 typically indicates you want the response topography to be different than the previous answer. A lag 2 is what we're looking for. A lag 2 says the current response must be different than the prior 2. Lag 3 is going to be the prior 3, lag 4, so on and so forth. So you get the idea. So in order to answer a lag schedule, you need to know what is the length of the lag? And that's going to be how many responses in between need to be different. In this case, the answer must be different than previous two to earn reinforcement. So the type of schedule that this resembles is going to be B, a lag 2 schedule. A 10-year-old client has begun engaging in headbanging against counters and tables. The function appears to be socially mediated attention. The supervising behavior analyst instructs parents and technicians to use response blocking in the event that headbanging occurs. What is the primary purpose of response blocking in this scenario? So we have a response blocking question and a purpose question. What is the purpose of response blocking? Response blocking can get a little confusing because people often associate it with extinction, and it is not extinction. Why is response blocking not extinction? Well, in order for extinction to happen, the response must occur so you can withhold reinforcement. If you're blocking the response, then extinction can't occur. So we know response blocking is not extinction. So response blocking is a preventative measure, right? We're preventing a response from occurring. In this case, what do we know? We know the 10-year-old client is headbanging, and it appears to be socially mediated attention. Now, if you're going to response block, you're going to be giving some sort of attention, even if you're trying to withhold as much as possible. You can't response block and not give some attention. That's the whole idea of response blocking, is to prevent. And so the analyst instructs parents and technicians to use response blocking if headbanging occurs. So what's going to be the purpose of response blocking given this information? A, to provide verbal consequences to the child in an attempt to reduce future headbanging. Well, the response blocking is not going to be a verbal consequence, especially for headbanging. Going to have to do something physical to intervene between the headbanging and the counters. So it's not going to be about the verbal consequences to reduce headbanging. B, to prevent harm to the client and reduce the likelihood of permanent injury. Absolutely, right? If we're going straight to response blocking, that's to prevent harm. And that is above all else our number one priority. We must prevent harm to the client. So B looks pretty good. C, removal of a desired stimulus as a consequence in an attempt to reduce behavior. Are we removing a desired stimulus? Think about the function. The function is attention. So if the function was sensory, maybe, right? Because we're preventing it. But even then, we're just preventing the headbanging against the counter and table. They might still get sensory feeling on your hand. Regardless, we're not removing a desired stimulus. If the headbanging starts to occur, we're simply blocking it. So the consequence is going to be adding that response blocking in, right? So we're adding the blocking, we're preventing the response from occurring. And then D, restricting access to sensory reinforcement, which should help put the behavior on extinction. Well, the function is not sensory, it's attention. So we can't put the behavior on extinction by restricting access to sensory because that's not function. So the primary purpose of response blocking in this scenario is to prevent harm to the client and reduce the likelihood of permanent injury. It's important here to note the function because that's going to remove C and D. The client wants the attention. So we're not removing desired stimulus. If anything, we're giving attention through response blocking, and we're not putting the behavior on extinction because the function is not sensory. You, a behavior analyst, are sitting at a bar when the lady next to you turns and starts asking about your job. You tell her what you do for a living, and she tells you all about her nephew who has autism and engages in some pretty severe behavior. It sounds like the function may be attention. The lady asks your opinion on what the parents should do. What should you say? All right, so what should you say to this lady that you're sitting next to at the bar? You're the behavior analyst, and this might happen in your real life, especially when you tell people what you do. When you do tell her, she says, well, I have a nephew who has autism, and they engage in severe behavior. Now, this puts you in a tough spot, right? You're a behavior analyst. By all accounts, you are competent. You're an expert in this field. However, as analysts, we have to uphold a certain code and we have to live by some rules, right? We don't go around giving unsolicited advice. We don't go around giving advice that isn't based on our assessments. So what should you say in this case? A, explain the attention function and offer a couple of interventions they could try. Well, just because it sounds like attention in no way means it's actually for attention. So you cannot start recommending function-based interventions without ever doing any sort of assessment yourself. B, teach the lady about differential reinforcement so that she can help her nephew. You can't offer the intervention up to this woman. You've never seen the client and you don't know her relationship. You don't know if she can go and actually engage in differential reinforcement with the client. There are too many variables to consider to think that it'll be okay. Try to teach differential reinforcement and then let this lady go and try to attempt it with her nephew. B is possibly putting the child and the parents and the lady in harm's way. C, ask for more information so you can formulate a behavior plan. Again, no, you would have to do your own direct assessment before anything else. So, regardless, if you can't do a direct assessment, you should not be providing behavior plans. And then D, you should not provide advice in the situation. Yes, we all want to help, right? Most of us are in this job to help. In cases like this, you are possibly going to be doing more harm than good if you start prescribing interventions and function based scenarios if you've never seen the kid and you've never done an assessment. So, as difficult as it might be, all you can do is empathize, offer maybe resources, but you cannot provide advice in this situation. If you were asked to identify a verbal operant that is evoked by a verbal stimulus, lacks point to point correspondence, and potentially has formal similarity with the stimulus, which option would you pick? All right, I threw this in here as kind of a teaching question. As I always say, when we're working on verbal operants, we need to know a few things. One, what evokes the behavior? That's first. What evokes that behavior? Two, what's going to reinforce the behavior? And then 3A, 3B is there point to point? Is there formal similarity? So if you're asked to identify a verbal operant that is evoked by a verbal stimulus, let's start there. Let's think about the operants that are evoked by a verbal stimulus. Is A man evoked by a verbal stimulus? It is not. A man is evoked by a motivating operation. What about B, a tact? Is tact evoked by a verbal stimulus? It is. Oh, I'm sorry. It's not. A tact is evoked by a non-verbal stimulus. What about a textual and an interverbal? Both of those are evoked by verbal stimuli. So C and D are possible. Let's look at lacks point-to-point correspondence. Does a textual lack point-to-point correspondence? It does not. A textual has point-to-point. Does an interverbal? It does. So our answer here is going to be D. Verbal operant questions can be that straightforward if you know those key ideas. What evokes it? What reinforces it? Is there point-to-point and formal similarity? Thank you for watching. Check out behavioranalyst.com for all of our study materials. Please subscribe for all of our updates. We update Friday, Saturday, and Sundays for the BCBA exam. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.